everyone, I'm Dr. Sindhya Rajiv. I work as an emergency physician at Stanford University in California. In this module, we'll talk about vaccines. Joining me for this discussion is Dr. Jennifer Newberry. Welcome.
Hello, I'm Dr. Newberry, also an emergency physician and faculty at Stanford University. I'm excited to talk with you all about vaccines.
There's a lot to talk about vaccines. In part one of this series, we'll cover what the different vaccines are and how they work in the body. We'll talk about how we know that these vaccines are even safe for us to get. And finally, we'll go over how well these vaccines work.
That all sounds great. Let's jump in.
At the time of this recording, more than 7 different vaccines have been administered around the world. The WHO, or World Health Organization, has approved 3 vaccines, and the United States Centers for Disease Control and Prevention, CDC, has also approved 3 vaccines. Dr. Newberry, how do these vaccines work?
All of the vaccines approved by the WHO and CDC fall into 2 types. There are mRNA vaccines and viral vector vaccines. In the past, most vaccines contained dead virus, which was introduced into the body. Your body would recognize the dead virus as an outsider and prepare the immune system to fight the virus in the future. Both types of SARS-CoV-2 vaccines, the mRNA and viral vector, are clever. Instead of putting the virus in your body, the vaccine tells your body how to make a particular unique piece of the virus. In this case, the unique and harmless piece is the SARS-CoV-2 spike protein. When your body receives these instructions, your cells translate the vaccine to make copies of the spike protein. Your immune system will recognize the spike protein as a stranger in your body, and in response, will prepare antibodies that in the future will detect and destroy cells that have SARS-CoV-2 spike proteins.
That's amazing. In other words, if we think of SARS-CoV-2 as a burglar on the loose, the vaccine is like a photo of the burglar's birthmark given to me, so that if I see the burglar in my neighborhood, I can recognize them by their birthmark and report them.
That's a great way to think about it. And just like the photo is only of the birthmark, not the whole person, the vaccine only carries information about the SARS-CoV-2 spike protein, not the entire virus itself. But the birthmark allows us to identify the burglar, just like the spike protein allows us to identify the SARS-CoV-2 virus.
Okay, now we know how these vaccines work. What about safety?
Like all vaccines, COVID-19 vaccines have gone through rigorous testing to make sure they are safe before being approved. And because COVID-19 was affecting many people all around the world, vaccine trials were able to enroll a large number of people from diverse populations. For example, the trials for the WHO-approved vaccines by AstraZeneca and Pfizer, for example, included over 20,000 people and over 40,000 people each. This is a lot more than other vaccine trials in the past.
What about who was in these trials? Were people from different races and ethnicities included? What about women and children?
As mentioned before, because COVID-19 had spread around the world, the WHO and CDC approved vaccine trials were able to be conducted in Brazil, Argentina, South Africa, Turkey, Germany, Belgium, the US, and the UK. For example, in Pfizer's vaccine trials, one of the WHO and CDC approved vaccines, 28% of participants were Latinx, 9% of participants were Black, and 4% of participants were Asian. And at least 50% of all participants were women.
That's wonderful that the trials included people from around the world.
Yes, of course. And this also helped with the speed.
Speaking of speed, should people be concerned how quickly the vaccine was approved? Were safety steps skipped?
This is really important to discuss. Safety checks were not skipped. They were combined. Rather than testing things step by step, for example, safety and then how well the drug worked, scientists did several steps at once, testing different things in the same trials.
That's really clever. And of course, I'm sure it helped to have everyone across the world concentrating on the same disease at once.
The whole world was working on one thing at the same time. And it turns out you can get amazing results that way. So yes, it seems like we made the vaccine quickly because we did. But speeding up that process had nothing to do with decreased safety and much more with the prioritization of this disease compared to how the vaccine process usually works. The vaccine still went through every single safety step.
Now that we've discussed vaccine safety in general, I would love to hear your thoughts on specific concerns people have around the COVID-19 vaccine. For example, some people worry that the vaccine itself can give us COVID-19. What are your thoughts?
No, it is not possible to get COVID-19 from the vaccine. The vaccines, both the mRNA and the viral vector vaccines, only have instructions on how to make a harmless portion of the virus, just enough to recognize it. The vaccine cannot teach your body how to produce the actual SARS-CoV-2 virus.
What about the mRNA itself? People are concerned that it is new technology.
The mRNA in this vaccine is safe. Our bodies make different types of mRNA every day. The DNA in our cells is copied into mRNA, which then can be used to make proteins. We would not be alive without mRNA in our bodies, and it's what allows life to function. This vaccine is the first approved vaccine that uses mRNA, but that does not mean that the technology itself is new. We've been researching and working on mRNA vaccine technology for over a decade.
That's really good to know. One other question. I've heard people worry that the mRNA vaccine can change our DNA.
No, that's not true. This vaccine cannot change our DNA, and that's because the vaccine mRNA never enters the nucleus of our cells, which is where DNA is found.
Oh, that is reassuring. Now that we know how the vaccines work and that no safety steps were skipped, how well do these vaccines work? What do we know from the trials and from vaccinating the public so far?
WHO standards require that for any vaccine to be considered successful, it must have at least 50% efficacy. In trials, the approved vaccines all were more than 70% effective. This means in the Pfizer trial, which was 95% effective, for every 100 people in the unvaccinated group that had COVID-19 with symptoms, only 5 people in the vaccinated group had COVID-19 with symptoms. The real-life results are also excellent. After vaccinating over 66 million people in the US, only less than 1%, that is 0.008% of people, have had breakthrough cases of COVID. That's huge. These vaccines work.
That is excellent. There's a lot of discussion about variants. How does this affect the vaccines?
There is some evidence that current vaccines may not be as effective against some variants. In fact, this may contribute to the difference in efficacy between early vaccine trials and newer ones. When the early vaccine trials were done, the variants were not common among study participants. But when the more recent vaccine trials were done, the new variants were prevalent in the population. Despite the new variants and slightly lower overall efficacy in trials, all the vaccines significantly reduce the risk of serious complications such as hospitalization and death.
That is very reassuring. Let's quickly review what we learned about vaccines.
First, we talked about how vaccines are safe for your body because it only teaches your body how to recognize the real virus. The vaccines do not change your DNA and cannot give you COVID-19.
Next, we talked about the vaccine production timeline. We learned that no safety steps were skipped, and the reason we got a vaccine so fast is because everyone was working together, directing money and efforts towards creating this vaccine, and because multiple steps were done at the same time.
We discussed the trials, that some of the earliest trials included over 40,000 people, which is more than in past vaccine trials. And these participant groups were diverse in gender and included participants from different races and ethnicities. Thank you all for taking the time to join us, and we hope this helps your understanding of how the COVID-19 vaccine works.
Don't forget to download the handout and join us for part 2 to continue the conversation on vaccines.